Good afternoon, dear colleagues, the organizers, the participants of today's webinar. It will be my pleasure to deliver a presentation on the experience in introducing ultra-portable digital X-ray and CAD systems in Uzbekistan. How we have started it. So shall we move to the next slide? Here you can see that Uzbekistan is located in the center of Central Asia, and total number of population is 36 million of people. And you can see that Uzbekistan is neighboring with Kazakhstan, Kyrgyzstan, Tajikistan, Turkmenistan, and Afghanistan. So as you can see on the map, we are located in the center of Central Asia. And here you can also see that the role of our partners in implementing portable X-ray and CAD systems. 2 units have been provided by Delft company, absolutely free of charge in 2022, and 2 portable devices have been procured from Delft with kind assistance of USAID, and also 14 X-ray systems. We have managed to obtain them this year under the kind assistance of Global Fund, and also the training materials for X-ray system. Well, we have, I would say, collected all these guidelines. We have also adjusted them according to our practice, and also we have reviewed and updated X-ray screening logs, and we have also, I would say, all the presentations which have been provided by Delft. We have shared them with our rentgenologists, radiologists, and TB doctors, and of course they help to update these guidelines. We have been in touch with USAID projects, and we have also developed the contact investigation program together with USAID project. And even here you can see that the portable X-ray devices have been disseminated between Tashkent city, Bukhara city, Namangan city, Samarkand city, Kashkadarya province, Tashkent province, and Karakalpakstan, Republic of Karakalpakstan. So we are using the portable Delft X-ray devices in all these regions. What has been done within this period? So as soon as we have procured this equipment, we have started installing these systems, and of course we have shared these training videos. We had training modules on CAD 40B box, as well as training on using software, and we had demo videos on using artificial intelligence by our technicians, and also we have been sharing and sharpening our practical knowledge within so-called practical sessions in mini groups. We have been using all these videos and knowledge on how to install and uninstall system, how to operate it. So whatever knowledge we have needed, we have shared. And in 2022, when we have received these Delft Live devices, representatives of Delft have been here with us. They had their presentation delivered. We had 3 days training. We had 5 days training for our rentgenologists and operators, for our doctors and operators, and also our specialists have been using it practically. I mean, we had so-called practical trainings, and we have been also screening the patients at the same time, and you have been seeing how this training has been combined with actual patient exam. And and in 2023, we had, as far as I mentioned, we have procured 14 units of equipment, and we had, I would say, very large-scale training for operators and for medical doctors. You can see that each of the specialists, they were very happy with a new system, especially with the artificial intelligence module. And you can see the equipment which was delivered to our storages under the grant from Global Fund. So here you can see that the results of screening using Delft Light, and please look at the statistics for Tashkent province. We had over 8,000 surveys, so you will be puzzled why Tashkent province has such a high indicator, because of first two units which we have procured in 2022, I mean in August and in October, were delivered to Tashkent, while remaining cities and provinces have received these units only in 2023. So all these new indicators starting from Tashkent, we have been screening them since May to June to July 2023. So what we have learned from employing artificial intelligence in TB screening, of course, artificial intelligence has been something new, and something new, which means always something different for and something interesting for people. And of course, people think, I mean, our operators think that it helps a triage, and it helps to, I would say, reduce the load from the doctor. So artificial intelligence is something which helps simplify the activity of röntgenologists. And first of all, they were scared that probably we will lose our jobs, but then they came to understand that it will ease the performance, and it helps us very quickly to receive patients. So within 3-5 seconds, you will be able to see these, I would say, focal lesions, and also it helps to have this heat map, and this heat map is very convenient to identify this pathology. And of course, such I would say parameters for us to it's very convenient, because we will be able to print out and to collect this data in the history, medical history. And of course, when we had this portable screening, after we had trained our specialists, we started the practical screening of people, and we have started from remote areas, and we have identified very important things, that it doesn't require additional expenses or having additional resources or using films or engaging additional personnel. So even you will have one X-ray operator, it will be quite enough than sending several people, and it will help you to reduce the cost of exams in remote areas. So as based on the a conclusion of the medical doctor, you will proceed with the exam, I mean, for sputum. The system can perform both online and offline. Previous speakers have been noted the connectivity issues, the connection issues. Yes, you're absolutely right. These things persist and they exist, but still you can have the I mean, the exposure, and you can, I would say, made your conclusion only when you will reach the hospital, but still it's very good. Well, talking about solar battery and the grid connectivity, of course, the solar battery is very nice thing, because if you do not have any access to grid, you can employ your solar battery, which I would say is the key advantage. And also you can identify the TB cases using artificial intelligence. Those who are going to use this system, it will help you with the scoring. It is very important.
Сам искусственный интеллект выдает
When, for example, you are using this artificial intelligence, it will show you the cases, I mean, this threshold, which is over 65 and closer to 100 you get, which means that the higher probability of TB you have. So we have been able to, I would say, study patients, and it also helped us to identify that we have very low doses of radiation, both for operator and the patient, and it's not that I would say heavy, 35 40 kgs, but as soon as you have taken an exposure, it means that you have the exposure with you, you have an image with you in a few seconds, and within one day you can embrace 200 250 patients a day. But if you are using two accumulators, two batteries, then you can embrace around 500 patients a day. And also, even in remote areas, I have mentioned, unfortunately we have a lot of such I would say remote areas which are very hard to access, and therefore it is very convenient to use these particular portable devices. And also you can render medical assistance in, I would say, very hard to access places. And let me now move to my last slide of my presentation. I would like to express my sincere gratitude for your valuable insight and information in your presentation. And also I would like to express my gratitude to our organizers. And regarding technical aspects, we experience no problem, no issues, because we have the rep office of Delft company in Uzbekistan, and we are in touch with them 24/7, and they render their assistance in immediate manner, and I would like to render my assistance also for this. And thank you so much once again for your kind attention.